Hello, everyone. It is a pleasure to have you all here today, and thank you so much for joining us. My name is Ashlyn Watkins. I will be your host today. I am an outreach coordinator in the California Department of Justice Division of Medical Fraud and Elder Abuse, which is commonly referenced by its acronym, the DMFEA. I just have a few quick announcements. If you would like to have the words displayed on your screen today, closed captioning is available by clicking the CC icon that reads Show Caption at the bottom of the screen. My teammate, Elizabeth Anguiano, will be moderating the chat and posting important information there. If you are joining as a reporter or are affiliated with the press and have questions, please send them via email to agpressoffice@doj.ca.gov. We have a great presentation for you all today. You will learn what hospice is, as well as what it is not, and receive key factors on how to spot signs of hospice fraud and how to report it. But before we dive into the presentation, I would like to introduce Jennifer Euler, who is our esteemed Chief Assistant Attorney General with the DMFEA. In her tenure as chief, she has overseen the investigation and prosecution of multitudes of fraud schemes perpetrated against the Medi-Cal program, including numerous cases involving hospice fraud. Prior to becoming the chief, Jennifer was the supervising Deputy Attorney General of DMFEA's facility enforcement team. And this team focuses on prosecuting systemic elder abuse and neglect that occurs in residential facilities throughout the state of California. So thank you, Chief Euler, for being with us today.
Thank you, Ashlyn. And hello and good morning. As Ashlyn said, I'm Jennifer Euler. I'm the Chief Assistant Attorney General for the Division of Medi-Cal Fraud and Elder Abuse. A little bit of background about us before we launch you into what you've really come here to see. DMFEA is the Medicaid Fraud Control Unit for the state of California. As such, it is our mission to protect some of California's most vulnerable residents and to help safeguard the state's Medi-Cal program. We accomplish this mission by investigating and prosecuting the abuse and neglect of elder and dependent adults, especially those living in residential care facilities or nursing homes, and by prosecuting Medi-Cal providers who are defrauding the Medi-Cal program. So fraud is perpetrated by medical providers in several forms, and it's constantly shifting over time. However, what remains constant is that the fraudsters put profit over people and that their criminal practices quite frequently endanger the lives and safety of those they should be caring for. In the last few years, we've seen an unprecedented rise in fraud perpetrated by companies and individuals who are supposed to be providing hospice services to those nearing the end of their life, a time when care and compassion is most important. That's why we're reaching out to the public to help educate everyone about what hospice is and about what hospice isn't. So thank you for being here today and helping us protect the hospice program for those who truly need hospice services. Back to you, Ashlyn.
Thank you, Chief Euler. Now, I would like to introduce you all to our Deputy Attorney General, Amanda Martin. Amanda Martin began her career as an intensive care and shock trauma nurse before earning her law degree from the University of Baltimore. For more than 16 years, she served as a prosecutor in the Maryland Attorney General's office, ultimately leading the elder abuse prosecutions for the Medicaid Fraud and Elder Abuse Unit. After moving to California, she worked in the Attorney General's Medi-Cal Fraud and Elder Abuse, and later directed statewide prosecutor training for the California District Attorneys Association. In 2023, She returned to DMFVA as a Deputy Attorney General on the Case Assessment Team, which is a team that she helped create. Dag Martin is passionately dedicated to protecting vulnerable populations and combating fraud and abuse, and she will be presenting today's hospice presentation.
Thank you, Ashlyn. Welcome, everyone, to our presentation, Preventing Hospice Fraud is Everyone's Responsibility. Our purpose today in showing this presentation is to inform you about what hospice fraud is and how everyone can help to prevent this crime. You know, before I was a prosecutor, when I was a brain injury nurse, I saw patients die in the chaos of trauma around strangers in a cold emergency room. This gave me a deep appreciation of hospice care and the comfort and compassion that comes with it. Today, as a Deputy Attorney General, I see the corruption of hospice care, which causes actual harm to patients. That harm is a failure to receive proper care, and it leads to suffering and tragic deaths. So what is hospice? I'll be talking today about hospice under the Medi-Cal program. However, hospice can come in different ways. It can come through private insurance and private pay and Medicare as well. We'll be focusing on the California Medi-Cal program. Medi-Cal is the program that provides healthcare payment coverage for low-income people and those with disabilities. Hospice care is one of the services that the Medi-Cal program provides, and it's intended to be one of the most compassionate benefits offered. And when it's done right, it brings together doctors, nurses, social workers, and counselors to care for a patient who is truly near the end of life. And the goal is to provide comfort, dignity, and peace for both the patient and their family. Hospice is a service for patients who are very sick. They have a terminal illness, and according to the guidelines, they have a life expectancy of 6 months or less. Patients in hospice no longer want treatments to cure them. It is not a curative program. It is a caring program. With less than 6 months to live, these patients want to enjoy their last days the best they can. Hospice is about the patient and their loved ones, giving the patient a peaceful end to their life. Let me give you an example. A woman has cancer and it has spread to her liver and brain. Her chemotherapy makes her terribly sick. Her doctor has told her that she has less than 6 months to live. She chooses hospice, which will stop any curative treatment, such as the chemotherapy she's receiving. This patient is not giving up. She just wants her remaining time at home to be where she is, surrounded by loved ones and free from the cycle of hospitals and painful treatment. The woman on our slide here, she is in what looks like hospice in a hospital-type bed, enjoying her dog. This is what honest hospice care is about. Common diseases that you'll see in hospice care are heart disease, liver failure, or Parkinson's disease. And the common side effects from treatment, curative treatment for these terminal illnesses are severe weakness, shortness of breath at rest, which causes terrible anxiety with people. Imagine not being able to breathe or catch your breath constantly. Uncontrolled pain is very common, and also nausea and vomiting. In hospice, medications are given to decrease the side effects. For example, giving morphine for pain. And there are also medications that help with nausea and vomiting, and also treatments that help with the shortness of breath. So, how hospice works. Let's talk a moment about hospice care under the Medi-Cal program. First, hospice is not a place, it's a service. It is designed for people who have a life-limiting illness and are expected by a primary care doctor and the hospice doctor to live less than 6 months. And the two doctors fill out a certification. Once that certification is signed and dated, the focus is now on providing comfort, dignity, and quality of life rather than curing the disease. Under Medi-Cal, patients can receive hospice care at home, in a nursing facility, or in certain residential settings. The program covers an entire team of professionals: doctors, nurses, social workers, chaplains, and trained volunteers who support not only the patient, but they also include the family. Medi-Cal pays for medications related to the side effects of terminal illness. They pay for nursing visits, medical equipment like hospital beds, and counseling to prepare the family and the patient for their death. The goal is to let people spend their last months with as much comfort and as little suffering as possible, surrounded by their loved ones. That's how hospice under Medi-Cal works when it's done right, supporting patients, honoring their choices, and giving families peace. Hospice care doesn't just automatically continue forever, however. To make sure patients still qualify, Medi-Cal requires that the patient be recertified. The first recertification is after 90 days. Then there's a second recertification that lasts another 90 days. And then after that 90 days, there is a every 60-day recertification. And each time, a hospice doctor has to review the patient's condition and sign a statement that the patient is still terminally ill. That's because if a patient's condition improves and they no longer meet the hospice criteria, which can happen, they should be discharged from hospice and returned to their regular Medi-Cal care. Patients can also re-enter hospice later if their condition worsens. And in short, this recertification is a safeguard because it makes sure hospice is being used for people who truly need it. And it helps prevent fraud or mistakes where healthy patients are kept in hospice just so that Medi-Cal providers can keep billing. What is hospice fraud? Well, I call it a profitable crime where victims suffer. And when we talk about hospice, you need to think about two different types of patients: terminal patients in hospice and non-terminal patients. Both of these groups of patients are involved in hospice fraud, and both of them have different outcomes from being enrolled in hospice care, whether they be actually terminal, or actually non-terminal. We want you to know that hospice fraud isn't just a Medi-Cal program problem, and that all people that are signed up for hospice care are both in these groups too, one of two, terminal or non-terminal. Now, let me tell you a story about a terminal patient in hospice fraud. Mr. R was 82 years old and truly terminal. He had advanced lung cancer. His doctor referred him to hospice so he could be kept comfortable at home with his family. That should have been the beginning of compassionate care. But the hospice company that signed him up was more interested in billing than caring. They billed Medi-Cal every day for nursing visits. Medi-Cal pays per diem every day. So the provider, when they bill Medi-Cal, they're paid a straight fee for hospice care per day. And it doesn't matter whether the provider stays for 5 minutes or 5 hours. It's a flat fee per day. So they billed Medi-Cal every day, this hospice company, for nursing visits, social work support, and pain management medications. On paper, it looked like Mr. R was surrounded by care. In reality, though, weeks went by without a single nurse showing up. His pain medication was delayed because the hospice didn't order it, and his daughter had to rush him to the ER when he couldn't breathe. The hospice company billed Medi-Cal anyway for services not provided. When his daughter complained, the company quickly discharged him, saying he was too complex. However, another hospice company picked him up and enrolled him and started to bill again the billing cycle that occurs per day with hospice. By the time Mr. R passed away, his family felt abandoned, and the Medi-Cal had been billed tens of thousands of dollars for care that never reached him. This is the other side of hospice fraud. Not just healthy people signed up, but dying patients being neglected and exploited at the moment they need dignity and compassion the most. Hospice, when done right, is a beautiful service, but when it's abused, it harms patients, families, and the entire Medi-Cal system. Now, let me tell you another story about hospice fraud in real life. This is about a patient who's non-terminal. Imagine this. A recruiter knocks on the door of a grandmother in South Sacramento. She's 74, diabetic, but doing well, walking every day and caring for her grandchildren. The recruiter tells her, "You qualify for free nursing visits, medications, and even supplies. All you have to do is sign here. It's called hospice, but don't worry, it doesn't mean you're dying." She signs, trusting the promise. And what happens next? Her Medi-Cal record now shows she's in hospice. That means her primary care doctor can no longer prescribe her diabetes medication or order lab tests for her. She starts running out of pills and can't get refills. The hospice provider bills Medi-Cal every day, hundreds of thousands of dollars, even though a nurse never shows up at her house. 3 months later, the hospice closes. Another recruiter arrives and transfers her to a new hospice company, starting the billing cycle all over again. Meanwhile, the grandmother is confused. Her health is declining, and her family doesn't understand why her regular doctor won't see her anymore. Well, her regular doctor can't see her anymore. She's on hospice, and that's anticipating that she's going to die in 6 months. However, she's not. This is what hospice fraud looks like when a healthy person is trapped in a hospice program they don't need. They're cut off from their real care. They're cut off from their primary care physician, and they're cut off from being prescribed medications that helps cure their problems of chronic disease that's not causing them to be terminally ill. So notice we have a non-terminal person abused by a fraudster Medi-Cal provider and a grandmother that was doing well, even caring for her grandchildren. Hospice fraud affects non-terminal and terminal people. Where do you find hospice fraud? All over, and it occurs a lot behind closed doors. Most hospice patients receive care at home, and that's private homes at the top of our list, not in facilities. When hospice works the way it's supposed to, a nurse comes regularly, pain medicine is delivered, equipment like hospital beds are provided, and families get support from social workers and chaplains. But in fraud schemes, the home setting is often where the abuse is most hidden. For example, we call them ghost visits. That's when providers bill Medi-Cal for nursing visits and no one actually shows up at the house. There's also minimal or neglected care. Patients get a quick 5-minute visit instead of the full assessment, medication management, and support that they're entitled to. Fraudulent hospices often stretch their staff thin. One nurse may be assigned 30 or more patients in different neighborhoods. Why? It's a way to cut costs. And if you cut costs, that means the fraudster Medi-Cal provider can pocket more money for themselves. There's unnecessary enrollment, like our grandmother that I told you about. Recruiters convince healthy seniors or those with chronic but non-terminal conditions like high blood pressure and diabetes, they encourage them to sign up. The fraud is invisible because it happens behind closed doors in the patient's own home. There's billing without supplies or medications. This is another type of fraud where companies bill for expensive pain pumps, oxygen, or comfort medications that never arrive at the home. And then families are left scrambling to buy the medications themselves. And there's isolation of the patient. Some hospices tell patients or families not to contact their regular doctors anymore. Patients are cut off from true medical oversight, and it can become a dangerous situation when fraudster Medi-Cal providers are in charge. So, in a nutshell, hospice is meant to bring dignity into the home. But in the hands of fraudsters, private homes become invisible crime scenes where patients are neglected, families are misled, and Medi-Cal is billed for care that never arrives. Let me give you an example of this. I ran into this with one of my cases. Investigators noticed that a small neighborhood nursing home suddenly had 80% of its residents enrolled in hospice. That number didn't make sense. In most facilities, only a small fraction of residents qualify for hospice at any given time. 80% is a lot of patients on hospice. When investigators pulled the records, they found billing for daily nursing visits, chaplain visits, and pain medications. But when they interviewed families, the story was different. No nurse has been here in weeks. One daughter said her father was still playing cards every day, but the paperwork listed him as actively dying. Staff nurses admitted they were told to sign charts for visits they didn't make. The facility and a partnered hospice agency had essentially created a pipeline, enrolling nearly every resident, whether terminal or not, to maximize billing. The result? Patients were falsely labeled as dying, families were misled, and Medi-Cal paid hundreds of thousands of dollars for care that either wasn't needed or never happened. That's how fraud in facilities like nursing homes and neighborhood care facilities, number 2 on our list, that's how that happens. It often looks, when you peel back the layers, that the numbers don't match the reality and the human stories reveal the truth. In nursing homes and neighborhood care facilities, fraud is often uncovered by comparing what's billed to what's really happening. Now, what about dishonest healthcare providers? Well, physicians can be hospice medical directors, and they can also be in private practice, but they're dishonest because they certify patients as terminally ill, even when they're not. Then they'll recertify patients past the eligibility period to keep the billing flowing. And they also are known to sign blank forms for recruiters to use later, so that when they're out and they're enrolling people, they'll have the patient's signature and already have the physician's signature, so that can be sent in and start billing right away. Another dishonest healthcare provider, hospice nurses. They document visits that never happen. They skip pain management or wound care, and they alter charts to look differently than what really happens. Also, social workers and counselors. They claim hours of bereavement or family counseling that never occurred, and they submit duplicate notes for multiple patients. In other words, they write one note and then they copy the same thing for all the other patients that they have on their list in that nursing home or neighborhood care facility. And we have the marketers or recruiters that I've talked about, and they bribe families or seniors with things like free groceries, air conditioners, or cash to enroll in a hospice program. And it makes it very tempting for these vulnerable people. The marketers also target nursing homes or poor neighborhoods with promises of free nursing care. And then they're the administrators or owners of hospice care. They own companies and they direct their staff to admit patients who are not terminal. They encourage false recertifications, and they bill Medi-Cal for high-level continuous care that was never provided. Then we have fake hospice or home health agencies. They are set up by a profit-driven owner with a doctor that is basically on paper. And they operate out of a small office with minimal staff. Most of the energy goes into recruiting patients, not providing care. Recruiters also go into nursing homes, neighborhoods, or churches when they offer their free groceries or medical equipment. The patients may be healthy or have chronic but not terminal conditions. They are falsely certified as having 6 months or less to live. Now, remember red flags. Red flags for hospice fraud is that a large number of patients leave hospice alive and well after 2 years, 3 years, if they can get away with it. If the company or the fraudster Medi-Cal provider can get away with it. So they're careful about that. The identification of documents that are in their chart might have the same wording over and over again. The staff turnover is high, so people may see a different person each time if they do get a visit. And the families complain that there are no nurses that came. And the same thing is with a fake home health agency. They often work with hospices and set up the same type of situation where they enroll the patient, they bill for the patient gets minimal, if any, services. Let me give you an example. This was in another one of my cases and involved a hospice marketer who went to a senior center. It was bingo night at the community senior center when a friendly woman walked in carrying bags of groceries. She introduced herself as a healthcare coordinator from a local hospice. And she told the group, you don't have to be dying to sign up. Hospice just means free nursing visits and medications. You'll get extra help at no cost. Plus, we're giving out groceries tonight as a thank you. And several seniors who were there, many of whom were healthy or only had high blood pressure or some other manageable chronic condition, filled out the paperwork, and the marketer assured them a doctor would take care of the rest. And the seniors never understood that by enrolling, they lost access to curative treatment from primary care doctors. One woman's blood pressure medication was stopped, leading to a hospitalization, and families were left confused and angry. And why these fraud schemes matter. I talk about these fraud schemes. Let me go back to why these fraud schemes matter. Well, there's financial harm, of course. And what happens is these fraudster Medi-Cal providers bill millions each year in our state on Medi-Cal hospice fraud. And that means taxpayer dollars meant for legitimate terminal patients are siphoned into luxury cars, real estate, and kickbacks. And there's patient harm that we've talked about before. And remember, there are two groups, the group that is terminally ill and the group that is not terminally ill. The group that's terminally ill may get very poor services because that cuts corners and allows the provider to make more money. Or the patient that's not terminally ill is cut off from their primary care physician and can't get access to their regular medications because hospice isn't about curative, it's about comfort. And patients who are not terminally ill want curative medications because they're not dying and they want to stay healthy. And there's an erosion of trust, of course, because people lose trust in hospice care, and it makes it hard for honest hospice care companies and programs to attract or recruit enrollees because there's so many of these fraudster Medi-Cal providers out in California, which is one of the main reasons we're giving this presentation today. Who is affected by hospice fraud? Everybody's affected by hospice fraud, and I'll tell you why. A patient who has 6 months to live and no longer wants treatment for their illness. These are the true hospice patients, and they will receive the care they need, they should, to prevent suffering and neglect. But what really happens with hospice fraud is they get no care. And what a terrible way to die when you are a patient enrolled in a program where they're cutting corners and you're not getting the psychological support that you're facing when dying, and also the comfort medications and everything else that goes with hospice programs, including supporting the family as well, who's preparing to have their loved one pass away. And then we have the patients who are not terminally ill and they want treatment for their illness, but they can't have access to their primary care physician anymore. And that can restrict their access to the medications they need for their diabetes, for their cholesterol, for their high blood pressure. Then we have a healthy person. They may be told they're terminally ill just to get enrolled into a hospice program. And when a healthy person is pulled into hospice fraud, they lose their doctor, their medicines, their dignity, and the taxpayers lose money that should have gone to the real patients that are end of life. Let me tell you about this patient that I know of, Mr. Lopez. Mr. Lopez was a 72-year-old retired bus driver who still enjoyed walking his dog every morning and gardening in the afternoons. One day, a hospice recruiter knocked on the door offering free groceries and extra nursing care. The recruiter assured him, and this is common, you'll hear it over and over again, you don't have to be dying to get this benefit. It just means more help, all for free. Trusting the promise, Mr. Lopez signed the paperwork. Within weeks, his primary care doctor refused to refill his blood pressure medicine because hospice had taken over his care. You can't have your primary care doctor anymore. So this is what happens. They can't refill your regular medications. A hospice nurse dropped off a box of morphine and sedatives just in case, even though he had no pain. Well, the hospice nurse dropped off something he didn't need because opiates like morphine that help alleviate pain are expensive. And that means our fraudster Medi-Cal provider is making money off of giving unneeded medications to the hospice enrollee. Confused and frightened, Mr. Lopez began to wonder if he was dying after all, and his daughter noticed he had stopped gardening and seemed depressed. Medi-Cal, meanwhile, paid thousands and thousands of dollars a month to the hospice for services he didn't need or rarely received. Then you have seniors, adults over 65, and if they get involved in a fraudulent hospice scheme, this can create a false terminal diagnosis in the senior's medical history. Think about this. It can impact future insurance coverage and care options they may have normally had. And then, if a fraud is discovered, some seniors may be dragged into investigations or audits through no fault of their own. Now, dependent adults, they're at a disadvantage because they have often a disability that causes them to be unable to advocate for themselves. And they may be cut off from specialists who manage chronic conditions like seizures, developmental disabilities, and traumatic brain injury that some dependent adults often have. Their regular medications, such as anticonvulsants or antipsychotics, may be stopped and put them at risk of some sort of a medical crisis. Who else is affected by hospice fraud? Families. They may expect regular nursing visits and support visits only to find the hospice never shows up. Then the family is scrambling, trying to provide care to their loved one without training or supplies. Communities are affected. There's a targeting of vulnerable neighborhoods. Fraudulent hospices often focus on low-income immigrant or minority communities, offering groceries, rent help, or free nursing in exchange for that hospital enrollment. California taxpayers. Medi-Cal is funded by California tax dollars. Every fraudulent hospice claim drains money from the state budget. California has some of the highest hospice fraud rates in the nation. Hundreds of millions of dollars each year are billed for patients who are not terminal or never receive care. The Medi-Cal program itself. Fraudulent hospices inflate spending and they drive up overall healthcare costs across the board. So the healthcare that Medi-Cal provides to people who really need it shrinks, and there's not enough money to go around to take care of these patients. And then there are the healthcare professionals in the hospice industry. Honest healthcare workers are often overlooked victims in hospice fraud because it damages their careers and their morale, because people start not to trusting hospice professionals or the people that are associated with it. And nurses, doctors, and social workers risk losing their license if they're caught up in a hospice scheme. The warning signs of hospice fraud. I've listed them here. We've talked about a lot. Pressures or bribe to sign the hospice enrollment papers. That's when a marketer comes to the door, or besides being recruited, there are people out on that just walk the streets. They go through senior apartment buildings. They go to nursing homes and assisted living facilities and try and enroll patients into the hospice program. And you know about the pressures or bribes now. Amazon cards and Target gift cards are also popular. Offers of free nursing services or goods like nutritional supplements. That would be like a case of Insure, or saying that a nurse will stop by. Also, housekeeping services. If a recruiter will often say, we'll send somebody over to clean your house. And that's tempting for people too. Another warning sign is not receiving answers to questions or concerns. And that's because providers, fraudster Medi-Cal providers aren't going to talk about what they're doing. They don't want their families to know or the patient to know that you have to be terminally ill with 6 months or less to live. They don't want the families to know that they can build Medi-Cal every day, that they get money for every day, whether they come for 5 minutes or 5 hours. We've talked about offered money for referrals. Sometimes recruiters will go into the nursing homes and give, say, around $2,000 to somebody. And that means that person in the nursing home will point out people that are close to discharge or would be good people to go into a hospice program. They just need that Medi-Cal number to start billing. And then we have the patient moving from one hospice company to another, which is called patient hopping. And they're doing that repeatedly. And what that does, it's a common marker for an organized hospice scheme. And what that means is that patients are repeatedly admitted and discharged in multiple hospice providers, and often through recruitment. And what happens is when they're discharged and picked up by somebody else, then that starts a fresh revenue stream of money, because you can rebill at a higher rate when a person is first admitted into hospice. So do you see that you get the higher rate, you keep them there for a while with minimal services, discharge them, and then you re-enroll them someplace else, and then you can start at that higher rate again. Here are more warning signs. Not getting copies of paperwork. Usually honest companies, hospice companies, will keep a notebook or papers of what's happened at a visit. We've talked about caregivers skipping visits, not understanding the cost of service. Again, the fraudster Medi-Cal provider doesn't want people to know that he's getting that hefty flat fee per day, whether they get services or not. They just have to bill. And this is not uncommon. Patients were never told they have a terminal illness, and they're shocked, or they're shocked that they're supposed to have a terminal illness and they're already enrolled in the hospice program. So hopefully presentations like this will spread the word about terminal illness requirements and non-terminal, knowing that non-terminal people are enrolled as well. And that has repercussions too, particularly being cut off from your primary care physician. So what can you do to prevent hospice fraud? The key is talking to your doctor, keeping in touch with your primary care doctor. If anyone comes to you or a loved one or someone you know and tries to enroll them in some sort of program that offers, like I say in the last point, offers too good to be true. We're going to give you free nursing care, free insure every week, all of these benefits. Have them check with their primary care doctor, because they're the ones that really should be evaluating your condition. And they're the ones that really should be certifying you if you are terminally ill. So be aware of that and know how important your primary care doctor is in this whole picture of hospice fraud as well. Now, what to do if you suspect hospice fraud? Here are some red flags. Patients who aren't sick and being told they're dying. Families are offered gifts or groceries. Nurses or aides don't show up but chart visits anyway. And then patients losing access to the regular doctor. These suspicious signs, note, just document it, but be safe. Safely gather information. Never confront a hospice care provider if you suspect that some fraud is going on. Just names, dates, and times are important. And also what's important is contacting our division, the Division of Medi-Cal Fraud and Elder Abuse. And at the bottom of the slide, you will have, there's a QR code, and it gives further information for getting in touch with our division and how you can fill out a complaint form as well. So in closing, I want to leave you with a final thought, because hospice fraud is rampant in California, which is the reason why we're doing this presentation to all of you and why it's so important to keep your eyes out, because it's a huge amount of potential harm to patients that doesn't need to be. So I'm leaving you with this final thought. When we report concerns, when we refuse to look the other way, when we share information, when we speak up, then we become a safeguard against hospice fraud. And I want to thank all of you for attending our presentation on preventing hospice fraud, because it truly is everyone's responsibility to look out. It helps all of us in so many ways, starting with the patient and ending with all of us spending our tax dollars wisely and not having it wasted by criminals that are corrupting a hospice fraud system, which is one of the most comforting benefits that Medi-Cal can provide. And now I'll send you back to Ashlyn. Thank you.
Thank you so much, Dag Martin, for giving such a great and informative educational presentation. It's phenomenal to hear all of the great efforts to combat fraud and abuse worked by the DMFEA. So in conclusion, I would like to reassure everyone that the DMFEA is here to safeguard the Medi-Cal program and California's most vulnerable people. If anyone would like to report fraud or abuse, as seen on the screen, there are several ways that you can get in contact with us. You may complete the online complaint form by visiting the clickable link that is in the chat. It is www.oag.ca.gov/DMFEA/reporting. Or you can send us an email to dmfeaoutreach@doj.ca.gov. Lastly, you can also reach us by phone at 1-800-722-0432. And the last option on the screen, as you can see, is to send us a letter. We would love to hear from all of you. Thank you, Chief Uhler and Dag Martin, and thank you all for being here. That concludes our presentation today. We really appreciate you joining us to hear about hospice fraud and how it is affecting our communities. This concludes our time together for now, and I hope that you all enjoy the rest of your day.